Click down, still in the 18,000, but a click down. Good news. That's a fact. It's a fact. That is good news, not my opinion. You see flattening of the curve, all these new expressions that we never used before. Plateau, flattening, rounding. Net change in hospitalizations, down. That's good news. 3-day rolling average, because remember, any one of these days of reporting, this is a new reporting system. It's imprecise. I wouldn't bet the farm on any one day's numbers, but a 3-day average starts to be a little more accurate. ICU admissions is down. That's good news. Intubations are down. That's very good news. Just on a real-life level. When a person is intubated, they're on a ventilator, 80% of the people will never come off the ventilator or thereabouts. So that's good news. Little reality check. You still have, on a day-to-day basis, about 2,000 people who are being diagnosed with COVID. So we're out of the woods. No, we're still in the woods. The good news is we showed that we can change the curve. Good news is, great news in my opinion, we can control the spread. That is great news. Because can you imagine if we couldn't control the spread? If we did all this and the spread kept going up. So we can control the spread. But you still have about 2,000 people a day who are new diagnosis coming into the hospital system. So it's still a serious public health issue. Lives lost yesterday, 752, which is the painful news of our reality day after day, and they are in our thoughts and prayers. You see 707 in hospitals, 45 in nursing homes. People are interested in those numbers and how those numbers are changing. But you see the terrible news has basically been flat over the past several days. Again, the number of deaths is a quote-unquote lagging indicator. It's almost disrespectful to put it in scientific terms. But these are people who were probably intubated, they were on a ventilator, and then again, a period of time on a ventilator normally has a bad outcome. The total losses, total number of deaths number, the CDC changed guidelines on how they want information reported. They want deaths, and then another category of probable deaths, which is a new category that's done by the local Department of Health or the coroner. So we're going to rationalize those new reporting requirements with local governments and get that information out as soon as we can. We're also, since we have a little bit of a period to take a breath, we're going to contact nursing homes and facilities to find out if there were other people who passed from COVID who were not necessarily in a hospital or in a nursing home, because there is a sense that there may be additional people who have passed away and they weren't included in the count because they weren't in a hospital, they weren't in a nursing home. So we'll be going through that. But basically, the healthcare situation has stabilized. The fears of overwhelming the healthcare system has not happened, thanks to the phenomenal work of our frontline workers, thanks to all the additional capacity that the hospital system created, over 50% additional capacity in 1 month. Just think of that. Thanks to the work that our federal government did, Army Corps of Engineers, providing the beds at Javits and Comfort. By the way, Javits, which is 2,500 bed capacity as the overflow valve, about 800 people have gone through Javits. So thank you very much. And that was a great service that was done by the federal government in a very short period of time.
That is New York Governor Andrew Cuomo updating the situation in New York State, saying just a moment ago that the health care situation in the state has, in his words, stabilized.